911.
Although rare in residential care, there may be an occurrence where a resident simply cannot be safely managed within the residential care environment. A resident is becoming increasingly dangerously aggressive, and there is frankly no redirecting the resident. Always summon emergency services. Call 911. Remember, we do not want to see you injured in the course of your work, and we do not want to see other residents injured either. If you notice that a resident is having acts of aggression more often, or maybe you've had a very passive resident that has suddenly started demonstrating aggressive behaviors, notify your supervisor immediately. Service plan changes may be necessary. We want to monitor that resident closely. The resident should have a medical evaluation by their physician to rule out any possible physical causes for this increase or change in level of aggression. It may also be necessary to bring in experts, geriatricians, psychiatric nurse consultants, etc., to help manage the care of this resident. It is never our goal to ask a resident to leave the community or have to evict a resident. However, in rare cases, it may be necessary. It is important as care professionals we work with our supervisors, physicians, the resident's family, and others to provide the best possible care in dealing with these aggressive behaviors. Remember, it all starts with you, your observations, your reporting, your making suggestions as to what interventions are best and which ones don't work at all for a particular resident. You are the key to successfully managing that resident within your community.
The good news is that we can manage aggressive behaviors. The way we interact, our approaches, the way we set our environment for our residents is a key point in managing aggressive behaviors.
While there are many potential factors that can contribute to agitation and aggression within our community, always look to the one that you have the greatest control over, and that is you, your actions, your methods of communication, your behavior towards a resident. Examine those. Ask yourself, is there anything that I'm doing that is perhaps contributing to the aggressive behaviors of this resident? And then change those behaviors. Use your positive interventions. Ask your coworkers for suggestions. Talk it over with your supervisor.
Today and in the future, when you're working with your resident, think about prevention. Your smile, your interaction, and your calm approaches is what most likely will thwart any aggressive behaviors.
You are very much appreciated as a professional caregiver. The fact that you have the skills, the expertise, and the knowledge to care for those with dementia is something you should be very proud of. Much success to you as you care for your residents with aggressive behaviors.